going. Oh my God. Ah. My car says I should inflate my tires. Great idea, but not for today. Good morning, everyone. Dr. Sanchez here. Thank you for coming to my channel. Thank you for watching my channel. Thank you for being here in general. It is Tuesday. I am on my way to the hospital at 5:40 in the morning. I woke up at like 5 a.m. this morning. We're gonna go through another 24-hour shift as a chief resident on trauma surgery. You never know what's gonna happen. You honestly never know. It could be anything. On trauma surgery, we cover all of the traumas, so the level 1s, the level 2s, airway alerts, any trauma consults, and we also cover general surgery at all hours, in the day, in the night. It's fun times. Very, very busy. It's too late for coffee today. I thought I was gonna wake up on time, but then I snoozed my alarm for about 20 minutes, almost 30 minutes, and then I got up. Was it worth it for an extra 20 minutes of sleep? I think so. It's gonna be great. And I go in the morning, get there at 6 a.m. Sign out starts promptly at 6 a.m. So whoever was there at night actually gives sign out to the day team, meaning we just go through the list of patients and just talk about each of them, why they're here, generally speaking, and then anything that may have happened overnight. Then from there, I typically try to get a coffee. Then I will go through the patient charts, just look at all of the vitals, the labs, the imaging, studies, make sure that everything looks good. And then we'll go round on the patients, unless there's an early case in the morning, which sometimes there is. If there is an early case, then I go straight to the operating room. My intern will round with the team. I'll typically round on whoever I get the chance to round on beforehand, and then in between cases, see the rest of the people. So level 1 traumas, these are gonna be your high acuity patients. These are going to be basically the sickest patients that come in after a traumatic event, whether that's a car crash, a motorcycle crash, a scooter crash, you name it. There are specific criteria for this, but I won't go through that. Level 2 traumas are going to be also patients who come in after some sort of accident, trauma, but these patients tend to be more stable. There's also specific criteria for this. This is also where you see all of the elderly people who fall on blood thinners. Airway alerts occur when a patient's airway is compromised for whatever reason. They're having an allergic reaction, something completely unrelated. We get called, anesthesia gets called. Anesthesia will typically try to intubate the patient initially, and then if they can't get an airway for whatever reason, then we start talking about surgical airway options, and then it's our kind of turn to step in. We have arrived to the call room. Oh, look. People have been eating the chocolate-covered almonds. See? I knew this was going to be a success. Lonely highlighter. I'll see you later. You'll get sign out. I don't know who left these cute little messages here. You got this, conquer the day, shine bright like a diamond. You're awesome, go kick ass. The eyeball. Oh, you want me to love it? No, I don't need it. No. There we go. We saw a level 1 trauma. It was a motorcycle accident. Luckily, the patient was very, very stable, so there weren't really any major injuries. We did the typical trauma thing, which is airway, breathing, circulation, etc. So the pink lead is specifically for residents. Our initial program director actually got us that lead so that everybody knew who the resident in the room was, and since my class is all female, he chose the pink, which clearly was the best option. I rounded with the team earlier on all of the trauma floor patients. Another team rounded in the ICU, and then another team rounded on all the general surgery patients. But I did do some general surgery cases yesterday, so I went and rounded afterwards on all of my general surgery post-ops. Got a super nutritious corn dog, some fries, whatever this is, and dark chocolate sea salt caramels. I helped my intern write about half of the notes. I discharged one of our patients, she did the rest of the discharges, and we made sure all the orders were placed. So called a couple of the other specialist teams to tell them about patients who need a specific consult. It is 1:15 p.m. It's gonna be great. It is 2:37. We just met with the team. The ICU team actually signed out the ICU to us because the ICU attending will be leaving. So there's still a resident here taking care of the ICU. We'll meet again around 6 p.m. because one of the PAs will actually come in. A couple of people on from the day will leave, and then we'll do a sign out again. Here for 24 hours. So for right now, I'm actually in the call room and I'm going to try to get some studying done. I ordered Uber Eats. I get a little drink to go with my food. Went to go see a consult for a bowel obstruction in the ED. At midnight, the PA that was covering the ICU actually left. I got sign out from her then. It's 2:04 in the morning and I've gotten a couple phone calls from the ICU. Nothing crazy. One of the phone calls was for a patient that was actually desatting on the ventilator, but then I went up to check on the patient and everything was fine. There's an intern here with me. She is currently up on the 7th floor actually checking on another patient, and then she's going to check in with me and tell me how they're doing. I actually got to take a nap last night. Just got back because around 4:30 they called a level 1 and a level 2. I went down to see them. The level 1 was pretty stable actually, ended up just being a fracture, pretty bad fracture, and then the level 2 was also stable and had a very bad open fracture that was dislocated. So we called orthopedic surgery, let them know about the patients. That all situated, and then we went, at this point it was like 6:10. I went and met with the team and signed out to them. So I signed out the entire ICU, all of the floor, general surgery and trauma patients, and the traumas that we just saw. Now they just called another level 1 trauma, but the new team is here, so they're answering that, and I'm gonna go home. You know what? This 24 was actually quite uneventful. I say uneventful, but I still saw, you know, consults, and we still got 2 level 1s and a level 2. But we're in a lot of surgeries and it wasn't crazy busy. I actually got to take a nap for a couple hours, which was nice. I think this was God's way of telling me that I needed a night like this. I think I really did. I don't know, I've just been having a week. I've been a little exhausted. And I think I needed a night that was more chill. Glad that it was very nice, smooth sailing, and now I can go home and get some more rest. And I even got to teach my intern for a little bit. We went over some stuff. She of course has to carry the floor phone around and answer a bunch of questions, but in between the questions we were able to go through some chest tube management and then talk a little bit about different topics in trauma. I would say it was a good night. Thank you for being here. Thank you for watching. It is now 6:54 and I'm arriving at my house. Just ignore the error message. I apparently need to fill my tires.